I moved to Cleveland Clinic, and what really, there is one episode that really moved me, that cemented my decision, is that I was at a Hotel Intercontinental, which is in the heart of our campus. I stayed there overnight, and the following morning, early in the morning, I was supposed to go to the office of Dr. Cosgrove, who was about to become a CEO, for an interview. So for those of you who visited the hospital today, you know how big it is. So I didn't know my way around. So somebody was there to wait for me, to guide me to Dr. Cosgrove's office. And it was early in the morning, so we were walking down the hallway, and there was this elderly lady who was clearly lost. She didn't know where she was. She didn't know where to go. And this person, who was a physician assistant, was taking me, a big shot prospect from Boston, to the person who runs an entire hospital. So you would think that he's going to make sure that I'm there in time. But he stopped and said, "Why don't you just wait here?" He came to that elderly lady, took her by her hand, and guided her through the hospital to where she needed to go for an appointment. Came back 10 to 15 minutes later, and we were late for my appointment with my future boss. Nobody had to explain anything to anyone because he was doing the right thing. He was there for the patient. That would not have happened in any other place in the world, not in a million years. So that's the type of a place where you want to work, and that's the reason why I came to Cleveland Clinic. People always ask me, so why do you live in Cleveland? You could live anywhere. I say, yeah, that's possible, but I simply cannot find Cleveland Clinic anyplace else. So I guess you're stuck with me.
So speaking of Cleveland Clinic and its extraordinary reputation and success, can you tell us a little bit about its reach, its impact, its role in the world today, especially in healthcare?
Well, the impact of the Cleveland Clinic is global. We are recognized as one of the best places to provide care in the world. Every ranking, rating that you see in our industry puts us up there in the top, right there with Mayo Clinic. We're always number one or number two. And this is a phenomenal responsibility, obviously, for a person who's now in charge for the entire organization. Now, our role, Maria, is to not only to adjust and accommodate to what's happening in the healthcare, but to in very many ways to shape the healthcare of the future. We have no small aspirations. We want to be the best place for healthcare anywhere in the world. And the reason why we want to be the best in the world, and we always aspire to be the best in the world in anything that we do, is because that's what I think we owe to our patients. None of us, if you were to have a choice, would like to give your family members in need in the hands of someone who's not the best in what they do. Is that fair? Nobody would like to say, no, I'm really looking for a person who's 37th in the world. I always have the same request for every person in the organization. Where people ask me, what do you expect of me? What should I do? How can I help you? I always have a sense that the best way that you can help me when I speak to my coworkers is just do your job in such a way that I don't have to worry about you. So that's the first thing. And the other thing is you have to aspire to be the best in the world in what you do. And the reason why being the best is so important, because once you achieve the excellence and undisputable level in anything, you quickly understand what it takes to become truly excellent in everything. And you also do begin to understand what it takes to bring the organization to that level. In the absence of that experience, it's impossible to do that. I hope that makes sense. But it is really fundamentally important to understand that. You have to strive to be the best in the world in what you do. Yeah, nothing else is worth doing.
And speaking of Cleveland Clinic and what an extraordinary institution it is and how lucky we are to have this in Cleveland, 21. It seems that everyone in America is talking about and worried about healthcare. It's a very challenging time to be a hospital CEO. How is Cleveland Clinic doing? And how is Cleveland Clinic positioned for the future? What kinds of things are you doing to meet the future challenges?
You know, everybody's speaking about healthcare and everybody says how challenging the times are, and I always kind of provide a little bit different angle to that. I don't think the times are that challenging. I really don't. I think there has never been better times to be in healthcare than today. I mean, we've never had more knowledge, we've never had better tools to help our patients, we never had better facilities, we never had better people than we're having today. So when people say, oh, remember the good old times, I tell them, okay, so which year do you have in mind? You know, good old times are only good in retrospect. Once you live them, they're always challenging. So, and then people have difficulties figuring out which are exactly the times that you would like to go back to. They were better than the time that is today. Oh, is it challenging? Of course it is. It's really challenging. You know, we have a huge responsibility. We serve millions of patients a year. You know, we have to support 66,000 families of people who work with us, and this is a phenomenal responsibility. But I would not like to, I do not like to be in a, so to say, a doom and gloom position about healthcare. I'm very much upbeat about healthcare and about the role that Cleveland Clinic can play. And continues to play. So yeah, it has never been a better time to be in healthcare, never. And I think the times ahead of us are going to be even better.
Excellent. What kind of things are you planning at Cleveland Clinic?
Yeah. Well, we plan a lot. I mean, the biggest effort for us for the future of the organization is try to keep people healthy. Instead of being there when you're ill, which we're always going to be there for people when they're sick, really the best way to transform our healthcare is we as a healthcare providers have to become partners in health for people who we care for, so that we can keep them healthy, and that is really transformative for healthcare. I was just meeting with a group today, and I used the metaphor. I said, hospitals today are like firefighters. We're there when a fire breaks out, but really the best thing that we can do for our communities is to stop fires from breaking out. So that's really where healthcare is heading. Cleveland Clinic will continue to grow. We're growing in here in Ohio, as you know, as you work at the clinic. We continue to grow here in our home state. We're now the largest employer in the state, ahead of Walmart, which was traditionally always the largest employer the last 10 years. 52,000 people work for Cleveland Clinic in Ohio alone. We have grown sevenfold from 150 beds to over 1,000 beds in Florida in the scope of the last year. We're growing internationally, as I mentioned, United Arab Emirates, China, London. We plan to serve twice as many patients in 4 years that we're serving today. So today we're serving about 2.5 million. Our plan is to exceed 5 million patients under our care by 5 years from now.
Well, and all of us well.
Thank you.
You know, kind of looking and comparing at different healthcare systems in different countries, you've now had the experience of working in, I had to change my notes because it's more than 3. So in the Swiss the Swiss healthcare system, is it Germany?
Croatia, Austria, Switzerland, United States, United Arab Emirates. 5.
So how would you just, compare and contrast some of those different models of healthcare and the delivery of healthcare services?
The best hospitals in the world are in the United States. Hands down, nobody should ever get confused about that. If you get sick, really sick, this is the place where you want to seek your healthcare. There are other countries, including Croatia, who are doing a much better job in addressing the overall health of the population because of the fact that the health of the nation is not just determined by the quality of their hospitals, but it's very much determined by something that we call the social determinants of health. People cannot stay healthy even if they're treated at a Cleveland clinic if they have no place to go to after we provide phenomenal surgery. They cannot stay healthy if they do not have an accessible food. They cannot stay healthy if they do not have a social services. They cannot stay healthy if they don't have a family to go back home to. So you can have the best hospitals in the world, but the health of the nation is not going to get in the right level unless all of those supporting services are around us. And I think this is a sad fact about the discussion in a political world of the United States today. People speak about the way that our healthcare is being financed, which is important, but it's not transformative. We should be having a conversation about how can we improve the healthcare of our nation, and whether somebody has Medicare, Medicaid, or private insurance is important, but not transformative. It's really not going to help fix the underlying problem.
So Cleveland Clinic really is an extraordinary place, and there were about 60 of us who were there today kind of touring it around, and you get used to it when you're there every day, but it really is extraordinary. Do you think there are any parts of Cleveland Clinic's philosophy or organizational attributes that can be replicated, do you think, in other places, even in Croatia, for example?
Yeah, the answer is absolutely yes, it can, because it has been done. Thank you. Probably the most paralyzing feature in any community or country is the preconceived notion that nothing can be done. That's paralyzing. That leads to nowhere. It's easy to find the reasons why something could not be done. That's the easiest job in the world. If you just want to lean back and say, well, it cannot be done, nothing, you're always going to be right. But you're not going to change the world. It can be done because we've been able to do it in very many different locations. Nationally, we have replicated Cleveland Clinic in Florida. The quality of care in Florida is the same as it is in Cleveland. We've replicated in the United Arab Emirates. We went to the United Arab Emirates, a country that has no educational infrastructure in medicine to speak of, no regulatory infrastructure. They've never supported an effort like this before, and we were able to replicate Cleveland Clinic in Abu Dhabi. We had caregivers out of 80 different countries, and we were able to teach them Cleveland Clinic values, Cleveland Clinic culture, because all people in healthcare have something in common. They're very much motivated to do the right thing. Nobody in our profession gets into profession with an intent not to provide the best care that they can to the patient. There's no nurse or doctor that comes to work and says, oh, today I'm going to wing it and I'm just going to do like 20% of what I can. I can assure you those people do not exist in our profession. And you can teach people how to do that, and it's very much a replicable model. I can tell you that people warmly embrace it. All healthcare professionals in the world are somewhat frustrated by the environments in which they work and by lack of appreciation for their skills, for their engagement. And I do believe that we have a model that is universal, because in our model that is based on a team contribution, not on the individual contribution, I do not particularly care about the individual excellence. I think it's important, but we're much more an orchestra than we're an assembly of soloists. Today, healthcare is a team sport. One cannot be successful unless you have phenomenal people around you. So we're very excited about the opportunity to work with one another, and that is replicable, and that can be taught, and it's just a wonderful thing, because it does create also a difference. I always say the reason why I'm in medicine and why I'm doing a job that I do is because I'm very passionate about the fact that in this line of work, I can do well and I can do good. There are very few professions when one can do well and good. I'm very, very passionate about this because I think that Cleveland Clinic has a recipe that is reproducible, that improves people's lives, that has a measurable impact in the lives of the families and people that we touch, and that's the job that is worth doing.
So turning just a little bit to healthcare in Croatia, one thing that seems to be really taking off or getting some traction is medical tourism. So ACAP, the Association of Croatian American Professionals, has a medical tourism task force that has been very active in the last few years that ACAP has been in existence. And we have many guests from Croatia here with us who are working in medical tourism in Croatia, and you met many of them this afternoon. What are your thoughts on that specialized healthcare niche for Croatia? And do you have any insight or thoughts about this possibility for Croatia?
I would say that I have gotten several inquiries, or at least people have asked me for an advice or an opinion about the healthcare tourism in Croatia. One thing that we know is that we have an excellent tourism. We have a beautiful country. Who wouldn't like to go to Croatia? On a healthcare tourism side, there are actually very few countries that have really made healthcare tourism a substantive part of their healthcare offerings. So that is not nearly as easy as people think that it might be. But for a country like ours, in the location that it is and with the circumstances that we have in Croatia, I think that the healthcare tourism has a chance in niche areas that do not require big capital investments. They do not require really complex, coordinated, high-risk care. So areas like physical therapy, rehabilitation, maybe elective services for dentistry, cosmetic surgery. Those are the type of the efforts that I believe would be welcomed by some countries. Because if you start to think about more complex things, some people have asked me about, can we build a cancer care center in Croatia? That is really, really difficult to do. First of all, it's a huge capital investment. Secondly, there are very few countries that would ever pay for cancer treatment that is oftentimes months long for their own people out of the premises that they can control, their own country. So I do believe that if there is a substantive opportunity, that's in the areas that I mentioned.
Thank you. So I'm not sure how much time we still have. Well, I am, because I have my watch, but it's just an effort to kind of move it to the Q&A.
Sure.
And I know that the audience has questions, but there were just a couple more things I wanted to touch on. So being CEO and president of an organization like Cleveland Clinic requires not only being an extraordinarily good doctor, but a businessman, spokesperson, relationship and consensus builder, and so much more that we can't even imagine. Can you tell us some of the challenges of leading this organization? Some lessons learned, some surprises? Is it what you imagined? Why or why not?
Nothing really prepares you for certain jobs. This is one of them. So you simply cannot be fully prepared to be a CEO of an organization that is as large as complex as we are. If you think just about the complexity of what we do in healthcare, I would say there is easily the most complex job of any job in any industry. And whenever I speak with my peers in other industries, the CEOs of large corporations in the United States, and I've gotten to know very many of them, every time when they hear about the complexity of the things that we deal with, they're just flabbergasted. Because if you just think about the complexity of our workforce, number of services that we provide, the research and educational mission, impact of a community, regulation, cost pressure, and the list starts going on and on and on and on. It is difficult to find industry that matches the complexity of running a large integrated healthcare delivery system. So it is a very complex, but once again, a very gratifying job, because the one thing that we can say every time we come back home, every single day, we can say in healthcare with confidence that we did something that matters. I have very many of my colleagues who are, let's say, in banking industry, finance industry, they do not see an immediate fruits of their labor every single day, not in a way that really creates an impact. We can say that it's very exciting. You know, the attributes that one has to have, I really can't tell you, Maria. I think that I mentioned to the group earlier today, probably the most important thing for me personally, and I've been now a CEO of this organization for 2 years. I had 3 years, so 5 years of CEO experience altogether. And probably the most important thing for those who either aspire to have this job or are having this job, I think, is to be comfortable with your own self. And to simply understand that you will not always be right, that there is a limit to what you can do, that you have to surround yourself with people who are exceptional, and have this, so to say, maintain your convictions even and make decisions that are right even when they're not popular. So that's probably the most important thing. I always tell people you have to pass your morning mirror test. And morning mirror test means that you have to be able to look yourself in the mirror every morning and say, I did the best I could today, or I did the best I could the day before, even if the things did not go as well as you thought they should. But it cannot be for a lack of effort. So while we tolerate, we all tolerate failures, that cannot be failures for lack of effort. So my expectation from people around me in the organization is you have to empty your tank every day. You cannot leave the effort on the table. It's the job that we do is too important. We take care of people's lives. There's a lot of suffering, including you have to empty your tank every single day.
Well, thank you, Dr. Mihaljevic. Thank you for everything you do for Cleveland Clinic and for our city. And thank you for joining us here tonight. I think we'll give people a few minutes for an opportunity to take some questions. Juliana, do you mind taking this microphone? We just have 2 of them. So I think we have maybe 5 or 10 minutes to take a few questions, and then Dr. Mihaljevic has to go on to his next set of meetings and travels and whatever else is next on your agenda, and then we can continue with our social.
Does anyone have a question?
Okay, we have a question over there.
Dr. Mihaljevic, when you were at Brigham Women's Hospital,
Yeah.
5 slots, 500 candidates. So why did they pick you?
Oh, you should ask them. I don't know. I was probably taller than most of them. No, I'm kidding. I worked there for a year, so I think they got to know me, and they got to know me. I think I probably just. I know one thing is probably outworked everyone there, and I think I'll just hope that they discovered the passion and the dedication that I had to our profession.
Juliana? Daniela.
Dr. Mihaljevic, it's a pleasure to have you here at our Hrvatski Dom, and I think I can speak for everybody when I say that it's been a delight to hear what you have to say, and I have a question for you.
Okay.
As a young physician, freshly graduated from the University of Zagreb, what advice would you give on a person embarking upon their career in medicine?
The best advice that I could ever give anyone, whether you're at the beginning of your career in medicine or in any other field, is that to surround yourself with the best people that you can. The choice of mentors is of critical importance, and the choice of work environment is equally important. Oftentimes people at the beginning of their professional careers may be seduced by financial awards, they may be seduced by perks. I have always tried to take a longer view and try to become the member of the best possible organization that I could get into, and find within that organization the best person that I could look up to and who can help me guide me along the way. And that has not been a calculated strategy, it has been more of an instinctive strategy for me. I was very, very fortunate. And I had phenomenal mentors. I had Dr. Vukicevic in Croatia, I had Dr. Turina in Zurich, I had Dr. Cohn, Larry Cohn, a dear, dear friend in Boston, Toby Cosgrove here in Cleveland, and then I was in these exceptionally good places. And so one thing that I would like to share, it's very flattering that you know, people, you give me too much attention and too much credit for what I've done. It is very seductive to think that I have done all of this because I'm exceptionally smart or I'm exceptionally capable, because I'm not. I just simply am not. The thing that I have, however, taken advantage of is the environments that were available for me. And probably the only thing that may have differentiated me from the pack is I kind of always worked harder than most.
Thank you very much.
Yeah, thank you.
Two questions, either or both.
Okay.
As you grow the Cleveland Clinic, how do you maintain the standards to keep it and maintain the level of excellence that it has here? And then you're surrounded by brilliant people who think they know best and should be in charge. How do you manage them?
You let them be in charge. There is no better cure for that, but let people take on the responsibility. To go on your first question first, you know, quality, we have to grow responsibly. Growing responsibly means that we have to grow in a way that we maintain the experience and the quality of care that Cleveland Clinic stands for. That's a clear objective. Growth for sake of growth would not be the right strategy. There are a number of ways to do it. We have exceptional people, we have exceptional processes, very good oversight, good business intelligence. This is how one can grow responsibly. To have very many people around who want to take charge and want to take on responsibility, I warmly welcome it. There is, for people who want to take additional responsibilities, always a job for them at a Cleveland Clinic. Once again, back to the things that there are people who think that they're right and want to be at the top of the heap. That is fine. In our organizational culture and structure, if a person is in a leadership position, we do not value their success based on the trajectory in their own careers. That is not what leadership is all about. The only thing that I really care about is if people who are in a leadership position have been able to elevate the careers of people around them and the part of the organization for which they're responsible for. If they have used the organization or people around them to promote their own career, they're not going to have a leadership position at the Cleveland Clinic. You know, leadership is a serving function. It's a responsibility rather than a privilege. You know, I'm not here to promote my career. Nobody will measure my success based on Tomislav Mihaljevic's career. I'm responsible for the growth of the organization and for the success of the enterprise.
Dr. Mihaljevic, 2 more questions?
Yes, 2 more is fine. Yes, thank you.
I've lost my power. I don't have my microphone. I've lost my
Oh,
power.
you lost your power? Here.
I don't have power.
Here. You need mine?
No, I'm just teasing.
I wish I were attention.
Good evening.
Good evening.
I'm honorary Croatian today.
Okay.
And
Welcome.
I'm honored. I have a question about, in a few years ago, Cleveland Clinic had started an attack on smoking. And it was very successful campaign, and Cuyahoga County saw a big decrease in number of smokers. Right now, I think all of us will agree that obesity has become a big issue, and second to only smoking, about causing cancer and other healthcare related issues. And as you rightly said, that hospital is the last place you want to be if you want to prevent. Healthcare is more about the society. And my question to you was, is Cleveland Clinic working to influence the food industry and the habits of the society, which has gotten into indulging in big meals and continuous meals?
Now, the obesity is a real issue, and I think you're onto something that is really, really important. It's of epidemic proportions worldwide. To answer your question, absolutely. We have a number of programs for weight management at the Cleveland Clinic, and we're becoming better and better in understanding what actually contributes to that. I'll just give you one quick notion. Even among our own people who work at the Cleveland Clinic, a very large number of them are overweight. Interestingly enough, only 40% of them participate in the programs to reduce their weight. And when I ask the person who's responsible for the weight loss management program, why don't people participate in the larger numbers? They say, well, because it doesn't work. You say, the things that we are telling to people every time when we tell them they're obese, we tell them stop eating or eat less and start exercising. And it doesn't work because they've heard it a million times and they still continue to be obese. So we're beginning to understand that the problem is much more complex than what it seems. Cleveland Clinic is always advocating for right thing in healthcare on a national front. Probably one of the most important recent advocacy was about dangers of vaping. For those of you who have teenage children, and I'm seeing some glances in the audience, if you vape, stop. It's a really dangerous thing to do. We're seeing more and more young people who are suffering from nicotine addiction, serious lung injuries. That is the horrible habit that is endangering, in particular, those who are most vulnerable, and those are teenage children. More than 80% of high school kids have vaped already. The vaping devices oftentimes have a concentration that is 30 times greater of nicotine, 30 times greater than cigarettes. That is not an innocent habit. It is very, very dangerous, and this is something, another example of things that we advocate for at a national front.
Is there one more question?
So one more question here.
And then,
Hello from Mihaljevic.
Yeah.
I have a question. So, what would happen if you try to implement your experience from Cleveland to Croatia? At the beginning of your conversation, you said you had a story about a doctor taking a patient by hand. And my mom came here to visit me when I had open heart surgery and I was in a coma for a month.
Yeah.
And she asked for a doctor, and Dr. King came out and shook her hand, and she cried like a baby, because that was something that's impossible in Croatia.
Yeah.
So have you ever thought about going to Croatia and try to suggest? Well, I can see your answer.
Yeah. Well, the thing is that it is possible in every environment. It's obviously possible in Croatia as well. You know, there is no geographical boundaries for compassion. The real issue is why is then, if, and rightfully so, you would probably ask me if that is so, why isn't it happening? I think that there are several components of a culture in any organization or any community, any country. The first components for success that we have at a Cleveland Clinic is we have a stable leadership. You know, we're an organization, this is what's happened at the Cleveland Clinic is 100 years in the making. This is the hospital that has had a stable trajectory for 100 years. This is not something that happens overnight. The second thing is having a clear values and a set of values and expectations for people who work at a Cleveland clinic. We are very passionate not only about what a person knows how to do, but how they do their job. That is really, really important for us. Being competent surgeon, competent proceduralist, we call it a table stakes. Most people know how to do it. But how they go about their business, how they relate to their patients, how they relate to their colleagues, that is really what matters to us. And I will tell you, we rarely let people go, rarely. But if we do, it is not because they're not competent providers, because they do not behave the way that we thought they should. And nobody is above that rule, by the way. Can be the world's foremost surgeon, doesn't matter. We hold every person to the same standards. And the third portion, it's the way that we model behaviors. Responsibility of the leadership is not just to have the right answer to right questions, but also to model the way that you go about your work. People will behave the way that the leaders in the organization behave. Young physicians will emulate those, or young professionals in any job, the behaviors of those who lead them. And I think that's one of the responsibilities of leadership. And my job is to make sure that those expectations are clear, that people understand what matters, and that we are very consistent about how to do this. Can it be done in Croatia? Absolutely. You have to have those three prerogatives. Stable leadership, clear values, and you have to model that behavior as an individual. There are no shortcuts to that. If I were to come, or anybody were to come and try to dictate it from some office any place in Croatia, nothing will change. But those are the components. These things do not happen overnight, do not happen by decree. Never happen by decree. And a lot of it is also based in the way that we award people, evaluate their performance. That's the reason why we do not have tenures. We are all in one-year contracts. I've signed my contract 15 times. I hope to sign it 16th time. But none of us has long-term contracts. We get evaluated for our performance every year. And the part of the performance, the vital part, is how we relate to our patients and how we relate to our colleagues. We actually measure it. There is something which is called patient experience, that there is a reflection of your colleagues. And one can simply not pass the muster if a person is destructive. I always say about the organizations that the destructive force of a bad character causes always much more damage to any organization in any profession than an individual brilliance makes a contribution. So it is absolutely no doubt in my mind that the right culture is really a key ingredient of every successful enterprise, or country, or community. Yeah.
So Dr. Mihaljevic, yes, please. Give him a round of applause.
Thank you.
So thank you for your leadership and your example and the clear vision. So we are very grateful. And before we close, please, we have just two announcements, please. The museum is open, please stop by. And this book about the history of Croatians in Cleveland is available at the back table for free. And now we have a couple of gifts that we'd like to give to you, and then we will give you a, yes.
Can I say just the thing before anyone starts bringing me gifts? Oh, Lord. Thank you very much for having me. I hope this was somewhat informative and mildly entertaining. I'm very, very happy that I was finally able to make it here. I have to say that I've been somewhat embarrassed for not showing up earlier. But I certainly hope that you understand the constraints of my job. You do not want to know what my schedule looks like. But I'm very proud to be a part of this community, and this means a lot to me, so thank you very much. You've been very, very gracious. Thank you.
Thank you.